Is it cancer curable? Yes, it is curable. Let us watch what the doctors are saying about it.
Thyroid is the commonest cancer. And in South, in fact, cervixuterine is the commonest cancer. Ovarian cancer, corpus uterine cancers are the commonest cancers. Then, when we see the transition of cancers, of course, cervix uterine cancer on the decline, breast cancer is on the increase, and the annual percent change is much higher compared to other parts of the country. So maybe detection, maybe improved methodology, but still it is on the rise. And of course, thyroid cancer, fortunately, it is a better prognosis, so it is also on the rise. Especially in coastal areas, we have observed that in coastal areas, thyroid cancer is quite common, which is not in northern part of thyroid cancer is not common in northern part of Kerala. Then the third cancer, colorectal cancer is also colorectal corpus uterine cancers are also on the rise. Because epithelial ovarian cancers are also on the rise. So most of the cancers, except mouth cancer, esophageal cancers, our cancer rates are on the rise. And burden also it is on the thereby burden also on the rise. So, in fact, strategies for cancer control, uh, geriatric oncology services will be very useful. And second, and another point, important point is our common cancers, breast cancer common. But stage at that, we know that if the disease can be detected in the early stage, it is almost curable, more than 90%. But still, our two-thirds of cancers are detected in the third, even in fourth stage also. That is very a sad story. In fact, we need to think of cancer primary prevention programs and providing awareness for detecting cases. In fact, reporting to a hospital at earlier if you see the symptom without ignoring the symptom, reporting to a hospital that is very essential. In fact, even among educated people delay the diagnosis symptoms and report to hospital late. So thereby stage and diagnosis will be third or fourth like that. So then we know that the detection, the cure rate is very bad, poor. So steps are to be taken for detecting for reporting cases early stage, particularly breast cancer. In fact, our 30% of cancers are breast cancer. So something seriously we need to think of how the disease can be detected in the early stage. It's creating awareness to the society that is very essential. Then I will share some of my hospital-based cancer registry experience. So we have observed that over the years, the dropout rates are very going to be high. It is increasing. So dropout rates and incomplete treatment completion. In fact, even early stage. I know that several early stage cases surgery taken and then they'll go away. So we know that there is it is almost the survival will be almost similar without taking any treatment. That is also very important. So, in fact, decentralization will be very useful if people in the nearby location complete treatment so that their cure rate, treatment completion will be very high. So that is also another important point. Treatment completion. Then I noted a few more points. Okay. So these are my thoughts for sharing with you.
Thank you very much. Can I invite to have yeah.
Good morning, and I would like to thank the organizers for this opportunity to talk to you. And I think it's a very good idea to get you know, people of different backgrounds together for an event of this sort. I hope that this continues. Unlike most of the people who talked before me and also people who are in this hall, I'm not directly concerned with cancer treatment. I'm a public epidemiologist, uh, and that is the perspective I'm going to bring. I have been talking or teaching public health policy for a long time, so I would like to bring a policy perspective on the challenges to cancer containment in Kerala, and that is how I have take this short presentation. So as you have seen already, and I'm not going to repeat, Kerala is ahead of all India average in terms of the incidence of cancer, and the leading cancers have already been pointed out. Is lung in main, mouth, colorectal, and breast cancer in the female. So all those are being delineated. But why we are ahead of the national average is something that we have to think about. On the one hand, as Dr. Yama pointed out, it might be a detection bias. More people might be getting it. But apart from that, there is obvious reason that we have the oldest population in India, growing population getting older. And that is an important contributor to this problem. But we also have to put in perspective that cancer incidence in Kerala is lower than the world average. And that is something that we have to understand. And also it is much less than some countries like USA. Uh, so that is something which we have to put it in perspective. So what are the types of problems that pose a challenge to our containment policies? I would say there are three groups. One is perception problems, misinformation problems, and financial problems. What are the perception problems? Perception problem starts with the idea among the public that cancer is the most important cause of death in Kerala, which is false. Cardiovascular diseases kill 1 in 4 people in Kerala. Cancer is only about 7 to 8%. But maybe for cancer therapists, it's a good thing that policymakers think cancer is very important. From that perspective, perhaps we should not be complaining. But the truth is that if you in perspective, cardiovascular death is much greater in Kerala. Second perception problem is that people believe that increasing trend in cancer in Kerala is caused by environmental carcinogens, especially toxins in the vegetables. That is a very common thing that we always get. And repeated surveys by Agricultural University, they take samples from the market and they look for pesticide residues in the vegetables, and they have found that it is not true. The pesticide residues in the vegetables sold in the market are very, very low. That is what the statistics show. But we still believe, most people still believe that all these carcinogens enter us through the vegetables. And because of that, if you look at the dietary surveys in all India level, the Kerala diet lacks in fresh vegetables, and which is actually might be a bad thing for cancer. So we don't eat enough vegetables as a population. So that is another perception problem. The third thing that people believe is that cancer is nearly always fatal, which is also wrong because a lot of cancer can be contained, some can be cured. People can live with it for a long time, so this message is not really gone to the people in a big way. So these are issues which policymakers should look at. Then misinformation on a large scale. Misinformation because, as I said, the reasons for cancer. In fact, there is a neglect of some very serious risk factors like obesity, alcohol, and lack of exercise, which are not really stressed as possible risk factors for cancer. These are not exhibited as possible risk factors for cancer. And people really don't know that alcohol can be a risk factor of cancer. Lack of exercise, obesity can be a risk factor of cancer. And then, of course, lack of awareness of something that they can do, like preventive interventions like vaccination, HPV, hepatitis vaccines. Late diagnosis is another. Many cancers are getting detected late because of various reasons. And because the primary care system is not really integrated cancer care that on a large scale. So there are advanced hospitals, but detection goes on at the primary care level. And then finally, with something which we always talk about, but we don't want to discuss, that is the shopping for therapy which happens in the population. They try various kinds of scientific and unscientific kinds of therapy, and by the time they get to the proper treatment, it is too late. So that is also another challenge to containment that comes from the population. Then finally, the financial problems, because lack of access in the primary care level, that is, if you go to primary care center, you may not be able to detect cancer even if you have an income. So that you get referred to another level, and on the way you will drop out, maybe because you don't have money to sustain that chain. Then catastrophic treatment charges in many instances. Catastrophic economists define as, they have a very definite definition of catastrophic treatment cost, which is like basically what it means is that the family has to go into debt to sustain the treatment. It happens all the time with cancer. Inadequate insurance, even in people who have insurance, probably they are under-insured. For many people, it is under-insurance a big reason for not like Dr. Yama suggested. People drop out of treatment normally because they don't have money. And for poorer people, it is loss of livelihood. So these are some of the big challenges to cancer containment, which policymakers in the state face. And what can we do? There are some solutions which are not maybe final solutions, but at least something which we can talk about. One is that a comprehensive cancer program, which for early detection, intervention, integration into the primary care center system, so that people who go for anything gets a cancer checkup after a certain age, and the early cancer is picked up. In campaigns of awareness of risk factors such as obesity, lack of exercise, alcohol, smoking, sedentariness, all those things. Creating cancer care fund for the poorer people, which may help them to get over their treatment costs. And for the rich people or people with employment and other income sources, they may be encouraged to go for a higher level of insurance, sustain this cancer care cost if at all they get this disease. So these are some of the suggestions. Because lack of time, I'm not going into the details. But these are serious issues, and I think we should be prepared for the future. As I said, our incidence rate now is not as high as USA or many of the other advanced countries. But the way we are, the lifestyle is currently in Kerala, we may reach there sooner rather than later. So we have to be prepared. Thank you.
Thank you.
The theme of this conclave, we would have already gone through it. Uniting minds, shaping futures, and conquering cancer. Very perfectly framed theme, and it perfectly encapsulates the spirit of collaboration and innovation that defines our mission. Cancer, as you all know, it's going up, and in its various forms continues to pose a formidable challenge to the public health globally and particularly here in Kerala. Just now we heard a discussion on the changing landscape of cancer in Kerala, and the various theories various theories proposed for this increase in insurance. The journey of cancer patient is often hardest. We are marked by physical and emotional challenges and struggles. We all know how difficult this particular disease makes and causing impact in the community as well as the family, both physically, mentally, and financially. However, in the face of this challenge, we also witness incredible resilience and the groundbreaking scientific advancements and the tireless dedication of healthcare professionals like medical workers of Kerala. This conclave serves as a vital platform for us to come together to share knowledge, to discuss the latest advancements in cancer diagnosis and treatment, to address the challenges we face on a day-to-day basis, and to collectively strategize for a future where cancer is no longer a death sentence but a manageable disease just like diabetes or hypertension. Over the next 2 days, we will delve into a wide array of topics from cutting-edge research to innovative therapeutic approaches, from preventive strategies to palliative care. And we will engage in insightful discussions, share best practices, and forge new collaborations. This is an opportunity to learn from each other and to challenge our perspectives and to strengthen our resolve in the fight against cancer. I'm particularly excited about the painting which is going on. I don't know how many of you have enjoyed that. Live painting by Willie Ratan at Kerala Cancer Conclave 2025 is something which is very attractive. And I invite all the attention after the conference and we will discuss about his theme. This unique initiative and let us use these 2 days wisely. By the time we go out from this hall, and let us engage in meaningful dialogue, foster new partnerships, and leave this conclave with a renewed energy and a clear roadmap for advancing cancer care in Kerala and beyond. Our collective efforts, united minds, and shared vision are crucial in shaping a future where we can truly conquer cancer. I thank all the participants and once again I thank our speaker and all the dignitaries for actively joining this. And I request them to take up this the discussion and the theme of the conference and probably a person like speaker can definitely contribute immensely to the policy making of this country. Once again, thank you all. Thanks.
I think as physicians, as oncologists, we are also guilty of sensationalizing things, and the pressure of having to perform at a very high level, especially in academic centers, has meant that often it's physicians and researchers who hide their findings beyond what the actual facts are. And I'm reminded of several such examples in the recent past which have misled the public, and I think this is important for the public to also understand that this is an era of misinformation. As Mr. Adhakshan said, you get paid for lies. So even when we assimilate news of a different nature, so I think this happened during the Israel-Iran war, that everyone suddenly became an expert on defense and war and why someone did this, and I think we are equally guilty of that. And to suddenly blame the public for interpreting medical news that way is probably foolish. And whichever field of life we are in, whichever bit of news that we assimilate, we should ourselves put the filter of, is this true news? Because fake news is much easier to disseminate than the truth.
You are very right, and remember recently the resveratrol hitting headlines that one pill a day can bring your chances of cancer coming back, and the doctors are not telling about that. Now, that matter, I would like to ask Jain Maman, as a person who is closely associated with the print media, if somebody is telling a fact that this particular thing can work, and you all know that nowadays healthcare information is seen almost on an everyday basis. Some hospital did a surgery, some hospital did this. It is actually making headlines, which we never used to see, say 5 years, 10 years back. Is it really helping? Now, if information is coming to your table, how will you validate the scientific part of it? Do you have a mechanism for that? Who do you trust for finding out whether it is true or false?
Thank you. That's a very good question which most media organizations face. I think a lot of hospitals these days, I'm not blaming hospitals, they will send out a PR. So our policy is when a medical breakthrough or something of that comes from a hospital, we always try to find out from other sources, medical sources always, to see what is it that they're trying to convey and what is the achievement, what is the breakthrough. So we don't try to hype a PR from a hospital, because once we start doing that, then every hospital will send out a press release. So this is what we try to do. We don't have a medical panel, but we have doctors who we contact and who we feel are at a position where they can give us the best advice. So this is, it happens to us in print. The immediacy of television, sometimes there could be slip-ups, but print, there is a lot more time for us to verify. And that's one of the advantages of print in this digital medium. Having said that, it is a challenge. It is a challenge because there is so much of breakthroughs happening in medicine now, in terms of drugs, treatments, successful surgeries. That's on one side. And on the other side, then you have these alternate treatments as well, which is, and that's a completely different approach which people are taking, and people are much more gullible for those alternate treatments. So it is very, very, very difficult. I'll just give you a quick example and stop. When I told my dentist, Dr. Shaji, who Dr. Bowen knows, that I was coming here. So he said, there is this reel which is circulating on social media, which says that, now I guess checking for oral cancer and all that if you have check for black spots in your mouth. So he said patients come, every day they're looking for black spots, then they'll find something, they'll press that part, and they'll come to the dentist and say, I have cancer, please check. So he said it's unbelievable what's going on. So a lot of this is the people from the other side who are disseminating. Many of them, we don't know if they're doctors or not, but these days in social media, everybody is a doctor. And there is no way to verify whether that person is a doctor. One way to get out of this, to make it much more reliable, is that medical associations, they should be the ones who should be disseminating research or any kind of information.
I understand. So there comes the importance of social media. Now, social media, I don't know how to explain it, but then everybody is trying to be on social media. We are also forced to be on social media, because unless you come out and tell about what's the right thing, people are easily going to get misled by whatever information is shared by anybody who can speak and post a video there. One issue what we found is like what you told. Yes, we have to come to the forefront and talk to the public. But say, for example, I am posting a video with great effort, calling someone, or say personally taking a video and posting it on my Facebook page, it will hardly hit 1,000 views. And anybody who is going to tell a fake treatment, we are going to see 1 million views. Now, how will you handle that? So whatever we are going to sincerely do, passing on a genuine information, why is it not accepted? Are Malayalis having a negativity bias? People want to go behind the fake things only?
Thank you, Sanju. First of all, thank you to the organizers for inviting me to this event. I was telling my friend M.G. Radhakrishnan that once I cross 60, I proactively accept invitations from medical fraternity, because I'm more likely to come across you than college teachers and others. So thank you for inviting me, though I'm really not looking forward to being in your consultancy room, but I may. Now, the point you mentioned about why is that fake news trends go viral more than normal news. There's a recent NHS study, I think, which came in 2023, which said that bad news travels 3 times as fast. But the number which you gave is probably more true, that it's between 1,000 to a million. Now, there are 3 separate reasons for this. First of all, when you are in distress, you are desperate. When you have cancer or somebody close to you have cancer, you want cure, you want solutions, you want instant solutions, you want easy solutions. You do not want a very scientific explanation. And fake news, pseudo solution, give it very easily. This is number 1. So you proactively seek out those simpler magical remedies. The second reason is that the Facebook algorithms proactively promote what is likely to go viral. What you mentioned, that there is an incentive for you to spread lies because it still brings you money. If you give good news, it doesn't go viral, and Instagram, Facebook, YouTube, others, they do not make revenue either. So therefore, they do not proactively promote this. And I think this is one area where institutionally, legally, we can probably intervene and ask for the algorithm to be made public or be fixed, especially in the case of healthcare. There is also a third reason, which is more institutional. Community in general have some sort of a distrust towards big pharma, corporate hospital, as you saw this head this morning, and so on. So they somehow assume that the legitimate information coming from doctors is somehow biased because there's a commercial interest behind it. Now, the doctors who are coming out of the medical colleges, as Pramesh mentioned, they're not trained to communicate this effectively in a language which is comfortable or something which is accessible. And I'll give you one example where I had been to maybe 1,500 separate platforms to speak. In each one platform, the last question to me is, Sir, Mulla Periyar will Mulla Periyar burst? And now I know a scientific answer, and I try to explain, this is. If I were to say that it will not burst, it's not about the common knowledge, so people are very unhappy. If I were to say it will burst, all my civil engineering friends are very unhappy because that's not very scientific. So I have now learned this magic trick. I was speaking to the Kerala cabinet, all cabinet members were there, and they asked the same question. I said, ഒരു അണ കെട്ടുന്നതും പെണ്ണ് കെട്ടുന്നതും ഏതാണ്ട് ഒരുപോലെ തന്നെയാണ്. കെട്ടുന്നത് എന്തും പൊട്ടാനുള്ള സാധ്യതയുണ്ട്. പക്ഷെ എന്ന് പൊട്ടുന്നു എന്നുള്ളത്, എന്ന് കെട്ടി എന്നുള്ളതിനെ അനുസരിച്ചല്ല ഇരിക്കുന്നത്, എങ്ങനെ കൊണ്ടു നടക്കുന്നു എന്നുള്ളതിനകത്ത്. And people get the message. That's often about translating this to something which people can relate. And that's a skill which you have to learn, as Pramesh mentioned, but also something which can be taught. Thank you.
Thank you. Thank you so much, sir. So, Dr. Neena is waiting from US. So, Dr. Neena, can you tell us about integrative oncology? I'll come to the second question once you explain about integrative oncology. What exactly is integrative oncology?
Want to start with a clarification. I was introduced as an integrative oncologist. I'm not. I am a family physician trained and working in the United States. I'm also in integrative medicine, so I'm double board certified in family medicine and integrative medicine. I practice integrative medicine in the context of continuity care or family medicine, but I also do consultations. So for my own patients who are diagnosed with cancer, or sometimes they come from the cancer center to get my recommendations on integrative management. With that, what is integrative oncology? So the definition of integrative medicine is looking at a person as a whole person and integrating all therapies and treatments, evidence-informed, that's required for the healing of the body, mind, and the spirit, including the genetic makeup and environment. So in integrative oncology, your mainstay is your conventional medicine treatment, but there's, to explain that, I want to explain a little bit about what is conventional medicine, which we all know, we are conventional medicine doctors. What's alternative medical systems? Alternative medical systems are old medical systems like Ayurveda or traditional Chinese medicine, who also can come from different philosophies, but can also treat a wide variety of illnesses like our conventional medicine or allopathic medicine. And then there's our alternative therapies or complementary therapies. Sometimes they are independent, like a osteopathy manipulation or a guided imagery, or sometimes it would be a particular therapy from a whole medical system. For example, yoga or meditation that originated in Ayurveda or Indian system, or acupuncture, which is not the whole traditional Chinese medicine, but a treatment modality. So integrative oncology or integrative medicine in that sense to any specialty, you are using your knowledge and training in the diagnosis and treatment for a particular condition, but also incorporating other modalities that's appropriate and with less risks and evidence informed. So in integrative oncology, you will go through your conventional diagnosis, staging, and treatment, whether it's surgery, chemotherapy, or radiation therapy, or immunotherapy. But as part of the treatment to tackle the side effects or the mind-body aspects, you may be using, and you must use the diet, the physical activity or exercise part, working on the habits. Maybe you would use acupuncture for pain relief, for nausea, for vomiting. Maybe you would use appropriate supplements. Of course, you may use a guided imagery or a mind-body approach. You would cater to the needs of the spirit, not in the religious sense, but bringing, tackling with their belief system, their meaning and purpose, and joy in their life. And there are different modalities, especially in our hospital. We incorporate music therapy, art therapy, and narrative medicine persons, psychologists. So, and we can expand on it. So that's the whole idea of integrative oncology.
Thank you.
And from the time of diagnosis to palliative or hospice care.
Understand. So let me ask from senior people in the crowd. So is this something which we can adopt, because they say they give the traditional scientific treatment along with other treatment? What's the opinion of the audience? Dr. Warrior can answer.
Definitely we can think about it, but the only issue is in Kerala, when we talk about the integration of something, any other stream of medicine, then the problem of quackery comes, all other, it will deviate from the main with the focus.
Alternative medicine might take the center stage.
Yeah, so that is the only issue. And some of the collaborations we have tried at MBR, we couldn't continue that because of the other issues. Like, suppose you are collaborating with an institution for conducting research on Ayurvedic drugs, the impact of Ayurvedic drugs in the management as an adjunct treatment for the cancer, along with the main, without deviating from the main guidelines. Then the issue is this Ayurvedic drugs will be projected as the probably a wonderful drug. You would have, since you are talking about the media influence and all other things, you would have seen the ashwagandha, the way ashwagandha was promoted. I should say that because I have treated him, he got better with the modern medicine only. But the way he projected, everybody took ashwagandha as the remedy for cancer. So such things will happen in Kerala. So without our
population, without our people realizing the role of each part, is difficult to integrate. This is my personal opinion.
Understood. So, Dr. Neena, so how do you prevent, doing such things, integrated medicine, not becoming a sort of pseudo medicine in US? Because here, whatever other modalities or whatever is mentioned, the traditional scientific treatment, whatever is not traditional, and the scientific treatment will be considered as pseudoscience. So, how do you prevent from making it not as pseudoscience?
I agree with Dr. Warrior. It's a little touchy subject in India or Kerala, visiting there and try to understand what's happening there and what's happening here. I think in America, this about 20, 30 years ago, the situation was like that. There was a lot of skepticism. But my professor, my work with Dr. Andrew White, I think he was a pioneer in this field. He's the one who coined the term integrative medicine rather than holistic medicine or alternative medicine. Over the years of work and making this very formal through a university, hospital, or medical college setup, eventually it gained momentum and people started trusting. So in India, it's a touchy subject because we have our own ancient system, and people, it's all depending on patients or our society's trust and mistrust. So it becomes our responsibility as evidence-based or conventional medicine people to put out their courses, education, both for the doctors and for the patients and the society, and in a government level or system level, organizational level, rather than ridiculing or criticizing the alternative practices of medicine, and very factual and in a way that our patients and our society and families would eventually buy and look up to us and trusted science and media for information.
Thank you. Dr. Ajay?
Yeah, so AMPOC actually conducted the cancer awareness survey. So we asked a question to the 2,500 public. This question was, do you believe alternative medicine alone is sufficient to take care of cancer? And Malayalis, only 3% said alternative medicine alone is sufficient. That is, vast majority of Malayalis believe that you have to go to a proper doctor. But the same survey, identity question done by American Society in the US, 4,000 adults, the response was 35%. 35% Americans believe that alternative therapy alone treats cancer. The difference between the US and India, despite the difference in the number, is that there are better legal frameworks and regulations in the US. Therefore, they are protected. Although 35% of the people in the US believe that alternative therapy quackery is enough, they can't access it because it's highly legally regulated. Now, in the absence of proper legal regulations in Kerala or in India, we will go for a toss.
Yeah. So, Dr. Pranesh, this is a common scenario what we see in our clinic. Say somebody tomorrow is diagnosed, a patient is coming to your clinic with breast cancer, and she comes and tells that, no, I don't want this treatment, I want to go for this fake, whatever cure is mentioned in a WhatsApp forwarded message. How will you handle that? Your face is problem. How will you tell, what will you tell the patient?
I think it's important that we share the right information with patients, and probably this is a situation which would take a lot more time to actually discuss with the patient than a normal consultation would. And finally, the answer lies in laying the facts on the table, giving the data in a way that it's not jargon and it's easily understandable by the patient, and hope and expect that the family with the patient would make a sensible decision. Coming back to the previous question, I think this is a universal problem. I don't think it's something restricted to Kerala or to India. During COVID, some of the most rampant misuse and abuse of drugs were from high-income countries. We had ivermectin, including the US president, who propagated hydroxychloroquine and at one point even bleach as a cure for COVID. So I think this is a universal phenomenon, and it's effective communication of science in a lay language which emphasizes the facts without making it too technical is the key to most of these problems. And I think regardless of which form of medicine, ivermectin is a as you call it, modern medicine drug, but it is being misused. Similarly was hydroxychloroquine. So regardless of the form of medicine, the emphasis has to be on evidence base. Whether it's Ayurveda, homeopathy, Siddha, whatever it might be, unless there is data, trials to support it, I don't think we can take the easy way out of saying that these are harmless drugs, there's nothing, what do we lose in giving it, and at best, at worst, it may do nothing, but at best it can actually relieve symptoms. A lot of them are actually harmful.
Jay, so my doubt is about the fear of FOMO among media professionals. So because people run after sensationalism. So how is it real? Does it exist in media circle? To get it because you have one news, you can see that it is there in 100 media platforms. Everybody is going to share that in some way or other. Is it real?
No, I don't think so. I think you should separate social media from media, and I think there is a big difference. You will find that a lot of this stuff going on in social media, but if you actually look at established mediums, you will not find this race to break something. In print, it doesn't happen. I know for sure it does not happen. Even television, I mean, no health, unless it's something which is all over the world. I don't think a TV news channel will have that on breaking news. And most of news platforms will always have a doctor as a panelist. I don't think a reporter can ever substitute for a doctor as a panelist. So that will never happen. And there are enough doctors who are, he mentioned that not everybody is a good communicator. But now there are lots of doctors who are very good communicators who are able to, communicate in very simple terms. I think that's the key. And another thing is things which are very technical in nature. It's not for the layman anyway. It's only for the medical community. So that there is no need to communicate that to the public.
So whatever we communicate in a social media post, you want to get depressed, just go and read the comment section of any post. I feel if tomorrow Mark Zuckerberg is going to ban comment box of Facebook, world is going to be a better place. How negative our people are. You go and see any TV channel, YouTube, the live scroll, just see how people respond. Why are our people like this? What joy are they finding in this? Don't they understand that, they're actually going to get depressed by typing all those nasty comments?
Thank you. I actually have a different opinion. The main reason why I write Facebook post is to read the comments. That's my biggest entertainment of this. And I must also say that it has made me a better commentator, because there are a lot of people with a lot more specific domain knowledge on the topic which I am writing. For example, if I were to write about medicine, somebody with a lot more precise information would come and augment, counteract, etc. my comment, my post, and it enriches the discussion, but also it enriches me. So certainly I am for one who is fully in support of comments. But certainly there is a problem. You have people who are abusive, people who are always attributing motives. For example, half the time when I write something, I am told that that's because I want to be an MLA in Kerala, that's why you are writing this or that. Anything good I write about Kerala, instantly it is said, oh, this is because you want to be an MLA or something. Now, many times I have been, in the social media language, I have been up in the air by people, abusing me. And I have not even once, I have thought about closing the comment section, because if if you look at the counterfactual, the situation when there is no comment, I think the world will be not a better place. So therefore, I would rather have the comment section, take the brand. If it is personal abuse, my philosophy is that if somebody abuses somebody who has commented on my post, then I will block. But if somebody abuses me, I'm okay because I'm in public domain. I'm prepared to be abused. That's how I take social media. Thank you.
Thank you, Doctor. Thank you so much, Dr. Pramesh. You can answer this. No, he is looking for comments to improvise himself. And do you think your post underneath somebody is coming and abusing you, you will be happy about that?
So, I think,
are you active in social media?
I'm not as active now as I used to be, but I'm pretty active on Twitter. I became less active after Musk took over for reasons well known to most of us. I find any kind of abuse objectionable. It's not something that I tolerate. I'd much easier mute or block them rather than have to go through this again. And I think a lot of this is because of the anonymity that social media provides us. You are here, even if I disagreed strongly with him, I wouldn't abuse him. Somebody with a very often nameless troll has the anonymity that social media offers, and even if it's a named person, nobody knows who the person abusing is, so it gives them the freedom to abuse. So it's a fact of life, and if you're active on social media, I think you need to be prepared to take that. But I also feel that we can use this in very constructive ways to actually disseminate information which is actually useful for the public, and and if we say whether we wish social media away or not, we need to look at the positives of it and make sure that we don't get away from that. That's the reason I didn't totally take myself off from Twitter, because it still gives you the opportunity to disseminate information in which is actually true.
Now, to the people from non-medical crowd, so do you people really look into the Google reviews before visiting a doctor?
Well, I do, because we are all part of the same.
But you know that most of the times it is cooked up.
Yeah, that is right. But you trust your own kind of senses or your own perspectives to some extent, that you have you get a feeling that this is not right, and so I think I trust myself to some extent. Maybe I might go wrong even in my trust, but I think I have certain senses or certain things that inside me would tell this is not right, or this fellow is not right, or this particular information is not right. But it comes through experiences and it comes through years. That should not be the case with everybody. But I think another issue is that this is not something you can see in isolation, because this is something which is happening in every field of life, every aspect. So that is why unprecedentedly we are going through a post-truth age where everybody wants truth to be what they think that is truth. They know that the truth is something else, but they still think that I don't support that particular truth, so I want to be in this particular. And this has been amplified by the emergence and hegemony of social media and silos like WhatsApps, and we are all in the same group. It's all echo chamber. We listen to our own voices. So unfortunately, when it comes to the field of medicine, it becomes literally a life and death issue. That is the only problem. Otherwise, we are going through this particular stage in life. I don't know what is going to happen. And as Jan said, the problem is that social media is far more mysterious than any other thing. But unfortunately, the legacy media to which I and Jan belong has been completely outmaneuvered by the social media. Now, all over the world, not just all over the world, even in small states like Kerala, studies show that more than 60% of people depend now on social media as a primary source of news. So there is no going back now. Now this has become a fact of life, even in the world of media, even in and this particular universal tendency of people going after negativity is also it's a well proven thing. Every social neuroscience studies have shown that people go for the messages should be negative. The message, they fear and anger are the things that actually they are pandering for. Instead of if you have a good thing to say, nobody is going going to care. So I think, this is happening in the world of politics, in the world of sociology, everywhere you have this problem of spreading false information, misinformation, fake news. And the only solution that has come out is to have an institutionalized fact-check systems. Everybody, I think the doctors should come out with a number of multiple, fact-check systems. And this is the only way. Otherwise, this is not going to change however much we would like to change. So I think this is the time to use social media, to use the same weapon to fight against, what's that wrong thing. So I think, so more and more fact-check kind of systems have to be introduced, and by professional bodies like the doctors and government or whatever it is.
Yeah, the one extension of what you have said, that Google reviews, as far as the oncology doctors are concerned, it carries a very, very high risk. The reason being, when somebody is made to wait for a long time, or in the OP, if we are not able to see them on an expected time, then they will write reviews. Secondly, when disease is not in our hand, when the disease is coming back again, and then there is a frustration of the person who is taking care of the patient, also will be expressed in the Google review, but it does not have any relationship, any truth. That is what the important problem we see. And as per the rule, the medical council has discouraged reviewing as well as rating the particular doctor. That is the current scenario. And the second point, the extension of what you said, the 60% of our people depend on social media for all this information.